All right, so let's start introductions for the webinar. I want to welcome everyone. My name is Márcio Galiato. I'm connecting from São Paulo, Brazil. And while I do the introductions, you can also make yourself, you can introduce yourself at the chat box. We have about 40 participants at the moment. If this is your first time in our webinars, at MHPSS.net webinars, I want to warmly welcome you for coming to this session. And the ones that have been in previous webinars, it's again want to say a warm welcome. And also, if perhaps some people here, they haven't seen this platform, and perhaps it's a new style session for us, the structure, and that's because we have changed the platform, and now from now on, this is our main channel for webinars, which is much lighter than the previous version. And most importantly, we can have, it's a limitless, the number of people that can participate. As you know, some previous webinars we had problems because people, they could not join the session because there was a limit in the room, which is not the case now. So today I'm not facilitating this webinar. I was just invited to do this initial welcome to people because today we have a very kind of different setup. It's a Q&A webinar, which my colleague Ananda Galappatti, which is connecting from Sri Lanka, and I have the pleasure to introduce him and pass the ball to you, Ananda, and explain how it's going to work and take the lead in the process. I will be here behind the scenes facilitating the chat box. If you have any questions, feel free to join.
Thank you very much, Marcio. Hello, everyone. Good morning or good evening, as it is appropriate. My name is Ananda Galappatti, and on behalf of MHPSS.net, I'm extremely pleased to welcome you all to this conversation about what's probably unarguably one of the most popular and visible contemporary activities in the field of MHPSS in emergency settings, psychological first aid. And for this, we're really very fortunate to have Dr. Leslie Snider join us. And Leslie has been very closely involved in the development of PFA content in close collaboration with the World Health Organization and its partners over the past several years. Leslie, who I hope will come on screen shortly, is a psychiatrist and public health professional with well over 20 years of experience in programming and research in diverse global settings. She directed the International Mental Health Studies program for 10 years at Tulane School of Public Health and Tropical Medicine. She's collaborated with numerous UN agencies, governmental and non-governmental organizations to develop international programs and quality care standards for children and families affected by disasters, conflict, HIV, AIDS, poverty, and other forms of exploitation, and has been a technical advisor to the US government, UNICEF, and others. Leslie is currently the director of the Global Collaborative for Child and Family, MHPSS, hosted by Save the Children Denmark. Leslie, as some of you might know, was also recently featured on an MHPSS.net webinar as the author of the 2018 published UNICEF community-based MHPSS operational framework. But today she's joining us as the primary author of one of the primary authors of the Psychological First Aid Guide for Field Workers that was published by WHO in 2011, and which has been translated into many languages and used widely in humanitarian emergencies. She's also been very closely involved in a number of other products related to PFA, and most recently been the author of a 5-year retrospective study commissioned by the Church of Sweden on the uptake and use of the guide, the PFA guide that she co-authored in 2011. It's a personal pleasure also to be hosting Leslie for this conversation, because she and I have had an ongoing exchange about the application of PFA ever since we worked together to do some early work on adapting and piloting the PFA guide in Sri Lanka soon after its publication. So I'd really like to invite Leslie to come online. Leslie, are you there?
Yes, I'm here. I hope you can both hear and see me. I don't know if you can.
Great. No, we can. Thank you.
Yeah,
so I'd like to invite you, Leslie, to give us a little background to your work, but also to the retrospective study, which will be at the heart of the conversation today.
Sure.
Before we start what I hope will be a conversation around the key questions that have been posed to us by colleagues joining this webinar from around the world. We received numerous questions in advance of this webinar, I think from colleagues working in more than 20 different settings, including some from some of the major recent emergencies, like the Indonesian context, but also the colleagues responding to the Rohingya crisis in Bangladesh. And we have clubbed together some of these questions because there were a lot of common concerns, and I'll be putting them to Leslie. But first, Leslie, if you would just give us a little background to
Sure.
the retrospective study. Thank you.
Sure. And although this is a conversation, and also thanks, Marcio and Ananda, for that nice introduction. It's fun to join you all again, but I promise I won't be on more webinars, I think, till the end of the year. So you'll have some other guests, I think. So the retrospective and PFA and this work. The retrospective itself, I just wanted to say that although this is a conversation, we do have a few slides, and these are slides that are just framing some of the data and some of the quotes that we found during the retrospective, so that we're interspersing that with the questions that Ananda will be asking. So the retrospective covered the years 2011 and 2000 to 2016. So the PFA guide was first launched. Sorry, I have to get the hang of the light touch here. The PFA guide was first launched in 2011, and the idea for the retrospective came about in 2016. It was commissioned by the Church of Sweden, and so we want to give great thanks to them for funding the retrospective. And we had advisory also by World Vision International and a peer review by members of the ISC MHPSS reference group. So just as a little bit of background, we are talking about the WHO guide. There are a lot of different psychological first aid publications out there. This is the one we launched in 2011. It was endorsed by 24 UN agencies and NGOs. We developed facilitation materials that were published in 2013. There was an Ebola adaptation done in 2014. And we are up to over 20 translations. I actually forgot to check the WHO website to find the exact number, but I think it's at least 24 at the moment, and it seems like every so often we get another translation in. So I do hope we're covering the languages of the participants here today. And what's been very interesting about the guide is how extensively it was taken up in humanitarian emergencies, and also in some other topics. And this was another reason for us to do the PFA retrospective. It was so extensively used that we really wanted to look back at its application. So we created something and we put it out there as a very accessible resource. We didn't put accreditation on it. We didn't put formal oversight on it, but we did try to ensure that it was used appropriately through our networks. So it's very interesting then to look back on the 5 years and to see what value it had, how our conception or use of it may have changed over time, and as the field has been evolving quite a lot in the last 5 years. And the potential dangers or cautions that people have raised, and then where to go from here. So this was the reason for the retrospective. We looked at processes of translation and adaptation, how it's been applied, how it's been used by different types of helpers, where it fits in the overall scheme. And then the retrospective itself provides recommendations for the future. In terms of methods, we did a desk review. We also did an online interagency survey. It was a snapshot, and we'll have a few slides about how people responded to that. We also did peer consultation with various actors who have been applying PFA in their settings or who have engaged in capacity building. There's a selection of case studies to illustrate lessons learned, and then again, the review. Okay. So just looking at who answered the questions and where they were from, we had 105 respondents on the survey that we did, and you can see they pretty much cover the world stage, and most were from international NGOs, but we also had UN agencies, government, academia, independent consultants. And then in terms of sectors that they identified where they primarily work, and they could choose more than one here, of course, the majority say MHPSS, but we also had child protection, health and education, and SGBV as top themes or sectors. And then a little lower down, food security and nutrition, shelter, and WASH. Probably a bit as we would expect. And then, of course, this slide is about respondents' familiarity with the guide, various materials. So on the left, we have the WHO PFA guide at the top, the facilitation material. Next is the Save the Children PFA for caregivers, and then other PFA resources under that, and the Ebola ones are at the bottom. So as you might expect, the respondents were very familiar with the PFA guide, although interestingly, maybe just over half with the facilitation materials. And in terms of their use of the resource, again, there was a lot of use of the PFA guide, but only 37% used the facilitation materials often. Total of 80% used them, but again, the numbers dropped down a little bit. So this comes to the first question. I'm sorry, Ananda, I can't hear you.
Sorry, I was muted.
Okay.
Sorry, thanks, Leslie. Just before we get to the first question that's been sent in, I would like to sort of turn to the participants for a moment and ask how many of you have actually used PFA either as an approach for direct support or as an approach that you've trained others on in the context of either an emergency response or in terms of emergency preparedness. And I wonder if you could just use the chat box on the right just to quickly type in and indicate your experience of using PFA and the kind of context in which you've had this experience, just so that we all have a sense of what our collective experience has been and the range of experiences in the room. The chat box is to your right of the screen. We've had training for humanitarian aid workers in northwest Syria. We've had PFA in emergency response, but also after critical incidents, use in Mindanao and the Visayas region of the Philippines, in disaster contexts in Venezuela, using it directly, but also to train others in a graduate school, volunteers after Typhoon Haiyan, TOT for nurses in Sierra Leone at the end of the Ebola crisis, Palestine and Liberia Ebola outbreak, Philippines and Sierra Leone, and also in this context of returnees to El Salvador. in emergency response and training. Actually, MISA is talking about the ILO looking at using it potentially, I think, in the future with migrant workers in the garment sector. And I think, thank you very much for sharing this. This is, I think, very indicative of the kind of range of contexts in which we see PFA being utilized, both, I think, globally as well as across these different sorts of sectors. And I think it kind of reinforces this sense that, PFA is almost everywhere. And I'd like to take our first question, which sort of it really comes to this, which is say, why PFA? What explains this rapid rise of PFA in recent years as an approach within the humanitarian response to crisis events or emergencies? Leslie, what are your thoughts of that?
Yes, and this was something that came up quite a bit in my interviews with in the peer interviews. Sort of why did it become so popular? And what people said is that mostly it's the simple language. It was very accessible because of the language. It also made it very easy to translate and adapt the guidance. Secondly, is that made it accessible to lay practitioners. Again, we didn't certify PFA. So if you receive an orientation in PFA, hopefully, I hope people don't do this, you don't receive a certificate saying I'm a certified PFA person of some kind. We've avoided that very carefully. So it's been accessible to a wide variety of people and to community members who are really on the front lines. Those are the people on the front lines, as well as professionals. So we also found that mental health professionals also appreciated the training because of the basic skills and because of the way it gives them options for how they can respond and assist in the immediate aftermath. And then lastly, what people said is that it's very useful for mainstreaming. It was a way that the MHPSS community can really begin putting practical tools into the hands of responders from other sectors. And just looking a little bit more at that, the strengths of the materials there were, one person said, well, look, listen, and link just sort of rolls off the tongue. So it does in English, of course, not necessarily in other languages, but I think, again, that simplicity and that it was really relatable, a simple product that was relatable so that you have a common denominator and you don't have to be a specialist to understand it. And then as we're seeing also in the chats that are coming in, it's been used in so many different ways. So in terms of its rapid rise, it seems to have versatility. And one of the interesting topics that PFA has been used for is also staff care. And that's important for humanitarian aid workers across sectors, for volunteers, and others. So I think the staff care and support angle was also an interesting application of it and an entry point. And I just want to make note of the quote that's on the right there. PFA gave a wonderful entry point for policy people to look at MHPSS, especially in a way that was not affected by too much stigma. So in terms of it becoming accessible, it was also more accessible to donors and policymakers. And here are also a couple of other quotes from the interviews about its sort of rapid rise. And you can see these sort of buzzwords here that it's mainstreaming for everybody. In the large quote, it was really about we can use it with so many different programs that we're offering. We can use it for programs for demobilized soldiers, voluntary returnees, survivors of trafficking, and I think that's what we're seeing in the chat box. But also these words like it's the foundation of what we do in MHPSS, or it's a basic building block of the work that we do globally.
Thanks, Leslie. Yeah, go ahead.
I was just going to say the other obvious reason for its accessibility are the translations, and you can see some of the covers there of the guides. But what's most interesting, and perhaps you can see it on this slide, is the way that people not only translated it, but also adapted it culturally. The pictures, the design, the terms that are used, and other cultural adaptations within the text. And I think that that's also a very important factor for its accessibility. And here you can see, that 80% of respondents in the survey use translated materials. So those translations have been very, very important. And I also actually wanted to throw a question back to Ananda, because you were the first to translate the guide into Tamil and Sinhalese. And I was also curious what made PFA so popular in the Sri Lankan context.
Well, thanks for that, Leslie. I think a lot of the things that you've mentioned are relevant to the uptake in Sri Lanka, and then a number of other contexts as well. And I think particularly the idea of this being something that we as MHPSS practitioners can offer to other sectors as a kind of bridge, as it were, to be able to raise issues of mental health and psychosocial support, and some of the considerations around, let's say, integration of these considerations in areas like WASH or legal responses to victims of violence. And that's been, or even consultations in Sri Lanka around what post-conflict reconciliation mechanisms might need to be, and how. And PFA was a very useful way of framing some of those initial concerns around how do you address people's distress, and how do you ensure that these other sectors don't contribute to it, but rather mitigate them. I would like to, also, comment on the point you made about the uptake from donors and from perhaps actors who are not traditional MHPSS actors, because I think there's an element of the fact that PFA doesn't require highly specialized skills. You can theoretically deliver it with a short orientation of approximately 1 day. And so it's relatively quick, it's relatively cheap to actually get rather large numbers of people going in, quote unquote, doing your intervention or providing the support to, again, large numbers of people in situations that are quite acute and where there's a great sense of a need to respond. So I think that that's also been something that it actually it serves needs for rapid response, for being able to respond without having to invest years or weeks or months or years of training, and it gives you big numbers, to put it slightly cynically. But I mean, it's a more generous, it allows you to reach more people. I also think, and I'd like you to respond to this, Leslie, in light of the question that's going to be coming up that I'd like to ask you about the evidence base, which is that I also feel that PFA came in, and one of the reasons for its uptake was that it filled a gap left by critical incident stress debriefing and other approaches that perhaps were being critiqued and being cautioned against by by the ISC guidelines, by some of the larger organizations that were leading in this field. And what's your thought about that? Is this, in a way, what do we do if we don't do those things? And the answer is PFA.
Sure. I'll put up our next slide. I just want to respond to one thing you said, which is that, that it was sort of cheap and easy to roll out. And I did have a respondent during interviews say that, she was a professional who, when she went to the field, she knew what to do. She knew how to train people in various communication skills and so forth. But what she liked about the guidance is that it was all neatly packaged. So she didn't have to keep designing it each time. It was just there. Everything was in it that were the basics of what you needed to know. So I think that's how a lot of people felt about it. It wasn't new. It wasn't actually groundbreaking types of information, but it was the packaging of it that was so helpful. So
Thanks.
The evidence, yeah, sure.
This is the question. The question we've got now about the evidence base is something that we received. I think 1/3 of the questions we had was on this. How do we know it works? How should we measure impact? What is your thinking about this, given that we are often under such pressure to demonstrate that what we do has evidence for its efficacy?
Yes. So I do love this question on evidence. It's a challenging question, and I have had interesting conversations about it with various people. The first thing I'd like to say is that I don't see psychological first aid as the alternative to critical incident stress debriefing. In terms of when we look at CISD, that was a group intervention. It was done by mental health professionals. PFA is really a very different animal. It's not an intervention per se, and it certainly doesn't have this kind of flow of you do this, then this, then this, then this. It's something rather flexible and adaptable. That also makes it very difficult and to measure, to evaluate, and to build an evidence base around. So first, I think it's interesting to know that this is not a new concept. It's not a new term. It was actually coined first in 1945. It was used with the Merchant Marines, I believe. And it was conceptualized as documenting and operationalizing good common sense. Those activities that sensible, caring human beings would do for each other anyway. So I like that quote very much. If we look at the evidence review, and you can see in the annex that there are systematic reviews of PFA in the annex, and that's summarized in the text, you will find there's no direct evidence of PFA's effectiveness measured in terms of impact for beneficiaries or clinical effectiveness. And neither of those surprises me, in fact. I don't think it's actually appropriate to try to measure clinical effectiveness if it's not a clinical intervention delivered by clinicians. So I think there's a bit of a mismatch there. And in terms of impact for beneficiaries, there's a lot of practical challenges around that, which I'll talk about in a moment. But I think it's also interesting that the findings point to the evidence for the validity, the feasibility, and the usefulness of PFA when it's appropriately applied. So what are some of those challenges? One is that PFA is a blanket term. It describes a range of approaches. You have different models that exist, and they have different components. And it's really quite difficult to say, well, let's measure each component and see which one is having the most impact. Because in fact, if you are helping somebody who's been recently impacted, you're helping them in terms of what they need in the moment. So you might not have the same sort of array of components that you use with this person versus another person. And there's a lot of decision making that happens within that interaction. So it's very flexible. It depends on the needs of the person being helped, the situation, as well as the skills of the helper and how much support or to what depth they're going to take their support. So what's offered, it can be highly variable, and that makes it very difficult to do something like a randomized control trial. And then there's the nature of interactions that present myriad challenges in crisis settings. So how do you actually document what is delivered to whom? How do you find adequate comparison groups or follow up with mobile populations? Even some suggestions to use pre-post designs in communities that are susceptible to disasters. It's very interesting, but again, it's assuming that you have a discrete intervention or components that you're going to be using. So when we asked people their thoughts on the evidence base, what was very interesting is that you had people on one side that said, this is simply not needed. And you see some of the quotes there and say, when you understand the essence of PFA, then it's a bit silly to say there needs to be an evidence base for the natural human things that we do. And then on the other hand, people said, yeah, but we are using this, and we should be able to really document what we think PFA will do. And the advice from this quote is, don't go on a fishing expedition with outcomes. Find a crisp research methodology and test something that we really want to know and could find out. So we do have some suggestions about that. And these are a few of them. And something that I'm quite interested in would be the impact of PFA capacity building on systems. Because what we've seen is that PFA seems to be this gateway. If you can introduce PFA in disaster preparedness or early in a response, it seems to be a gateway to talk about broader MHPSS issues and needs and services and coordination. So what I would be curious about is where there have been large-scale capacity building efforts, how has that influenced the development of other types of MHPSS interventions and systems building? Another interesting area to research would be the impact of PFA orientation on participants themselves. Some of that could be issues related to stigma. How do I understand people who have distress? How about myself? Do I have a greater understanding of myself? People within my personal life, not just those who I'm helping. And often at the end of the orientation, that's what people would say to us, is that they understand their friends and family better, and they were going to go home and apply it right away with friends and family. And then another thing would be the issues around well-being, staff well-being. There's also people's confidence to offer PFA. Now, we know that your confidence to do something isn't a direct correlation with your competence to actually do it. But I think that PFA orientations, because it normalizes and demystifies the concept, perhaps makes it easier for some people who might be reluctant to offer help to say, oh, yes, but I can do that. Or, yes, I do that with my friends, in fact. So this is something that I can offer. And it broadens the base of responders that we have. I think a third thing that would be very interesting to research would be, how do we do quality control in large-scale capacity building? How do we ensure fidelity to the model? How do we know that people are understanding the concepts, and especially when you have cascade training models?
Thanks, Leslie. If I could just go back 1 second, I think, the question around quality control and, how well can we ensure that people who are trained on PFA are able to provide it in line with the principles and apply it, I think is a question that came up also in those that were submitted to us, and I hope that we can talk a little bit more about that in the context of a later question around orientation on PFA. But I think it's also very interesting that you suggest that some of the benefits of PFA may not be limited to reducing distress in individuals who are provided with psychological first aid in a situation of acute distress. In fact, the 3 items you have here are much more about other parts of the system, about humanitarian responders, and so on. So I think it kind of leads perhaps to our next question, which again was a very popular one, let's say, or was submitted by a number of people. And I apologize for this slide. What it says is, what is the place of PFA within a wider humanitarian and MHPSS response? Because people were wondering, is PFA being applied, in contexts where it perhaps ought not to be applied? Should it be provided as a standalone response with designated PFA responders, or is that or should it be something that is much more integrated? Is it something that should interface with the broad humanitarian response, or be provided more from within a MHPSS frame? And then in that larger, the scope of that larger response, what are the limits of PFA? We've had a question even in the chat right now around, the relevance of PFA within a protracted or chronic crisis. Is it a first step that has to lead to another step? And if the other steps are not there, should we do PFA at all?
Okay, these are great questions. I want to, just before I launch into that, I want to make one comment about the evidence. And this was a conversation that you and I had once, Ananda, where, if you're wondering what the impact would be for beneficiaries, maybe what we're actually getting at is that there's a core essence of PFA that is about ethical practice, that is about doing no harm. And I suppose the questions that I would want to ask somebody is, did you feel you were treated with respect? Did you feel the person spoke with you in a way that you could understand? Were they careful not to judge you? And did they help you connect with supports that might help you? So, some of those around ethical principles or good practice. So I think with beneficiaries, we need to get to that core, because PFA supports those kinds of humanitarian standards of practice.
And Leslie, if I could just jump in there, I think, the way you articulate it, in some ways, my mind jumps to the ISC M&E, common M&E framework for MHPSS outcomes. And there is that component around, let's say, the do no harm part of humanitarian response, and that people feel that the response they've experienced has not undermined them in certain ways. And there are certain indicators and perhaps into verification that might be applied to address that particular question.
Yeah, great, thank you. So your next question, it's a very, very important question, this one on the limits and what is the place of PFA. So in terms of these kind of longer term protracted emergencies, I think it's important for people to begin to see PFA as a skill set that we offer, that we can help people improve their skills in the way they relate to distressed people. So as a skill set, it can be useful at various phases of an emergency, but it's important then to distinguish it from interventions. PFA itself is not an intervention. Basic emergency psychosocial support is an intervention, and you would use the skills of psychological first aid as you would be delivering that. So I think and anybody can do that. If you're a teacher and there's an event that happens at the school, a crisis event, that teacher can help to provide that kind of safety and calming for the students, for example. Some people who would have more experience as psychosocial MHPSS workers may be able to go further with basic psychosocial support. So the first thing is to really change our language about how we're referring to PFA, that PFA is really a skill set. So in light of that, we did ask how PFA was perceived. And in general, 70% of people said that it is perceived correctly, according to its definitions as first-line psychosocial support, humane supportive practical assistance. But interestingly, nearly half felt that PFA was perceived as psychological counseling for trauma survivors, which it is not, or that can be offered as a standalone intervention. And a third said that PFA is perceived as something only professionals should do. So there are some misperceptions out there. And it's interesting to note, we didn't ask, how do you perceive it? We asked, how do you think it's perceived by others? And then if you look at this slide, we also asked sort of how is it most useful in humanitarian response? And a lot of respondents felt that it was its accessibility to non-professionals, being able to orient humanitarian aid workers or emergency responders from other sectors as an essential tool for first-line responders, et cetera, et cetera. And again, when we're looking at sort of what is its scope, people said it's been most useful when training frontline workers from non-MHPSS sectors, so that kind of mainstreaming element. And this person said, I often carry out training on the IS guidelines, and I cover action sheets and where PFA falls within the pyramid, so this is integrated within what they're doing. And others said also that it's an essential part of any capacity building model. But I really like this third one. It's building communities of practice at local, region, or national levels that provide that entry point to other programming. So as I was saying earlier, that if you, it provides this kind of accessible and easy way of overcoming stigma, overcoming the kind of mystical nature we have around MHPSS, and giving people that opportunity to engage. These quotes are about how it helps to adopt a more humane approach with do no harm, especially for staff who have limited training in psychosocial work, but they might be in the position of being first responders. And this was a quote from the Ebola crisis, using it with ambulance teams. They were trained, they used PFA in the field when picking up patients from communities and as a way to keep themselves safe and to be able to interface with the families. So a very interesting question and responses that we asked was, where does PFA fit on the pyramid? And my own thinking on this has evolved since we launched the guide in 2011. And I think that originally we said, well, it's a layer 3 intervention, meaning that it's a focused one-on-one psychosocial support initiative. And you'll see that a third of the respondents selected 3 only as their answer as to where it fits. But another third of respondents would put it at layers 1, 2, and 3, or layers 1 and 2 only. And then you see there's an array of other responders. 12% said it just belongs on basic services and security on layer 1. So there's quite a range here on how people are understanding where it fits. And what this slide tells me, and is kind of mirroring the evolution of my own thinking, is that as a skill set, it's useful in various ways. For various purposes. When I was a community psychiatrist and I would have a patient who was very distressed, what I was doing at that moment was using PFA skills. I wasn't using my psychiatric clinical skills. So for me as a mental health professional, it was useful in certain circumstances. But it's useful across the board in different ways. So I think the key here is to actually not put PFA on any layer of an intervention pyramid. So not seeing it as an intervention, but rather seeing it as a skill set that would cut across.
Before we get to the next very interesting question, Leslie, I'd just like to ask you to sort of respond to the second part of this question that was posed, which was, what is the relevance of PFA in situations of, ongoing difficulty or protracted crises? Because some of the people writing in said, look, we see people using PFA at the outset with a acute disaster response, emergency response, but then we see the same activities being carried out 6 months later. Surely PFA, whilst relevant if someone is in an acute crisis, is not something that you're doing programmatically. It's not sufficient. What comes after? And that's also something that many people that I've been working in training on when we've done orientations around PFA say, look, what happens after PFA? What if there are no services, programs to refer to? There's a clear dilemma and difficulty for providers, especially those who are not themselves MHPSS practitioners and who don't have other skill sets and other interventions that they can then deploy.
Yes, and I would say that perhaps a way to get around this dilemma, because I think we have people on the webinar who are writing proposals, for example, for funding, that, orientation, the actual intervention you're doing emergently is sort of basic frontline psychosocial support. And within that, you can offer the orientation in PFA to build people's skills for that first response. You can offer training in the IASC MHPSS guidelines to give people a kind of broader sense of the field and coordination, and other things that you may offer. And then that should really then be leading into whatever your program is going to be, your MHPSS program. So those things need to then transition, just as child-friendly spaces will transition to something else at some point. So that this is a component of skills that you're offering, but not necessarily an actual program, so that it really needs a different conception. And I think what's been very useful in recent years is all of these burgeoning tools that we have for the scalable interventions. There are a lot of really useful tools and program ideas that I think are shared on MHPSS.net. And the range of things that we have available to begin to build programs around are growing.
Thank you, Leslie. I think that's an interesting thing to perhaps. I think it's something that people in the field struggle with, is the notion that certain actors perhaps invest, and donors perhaps invest in PFA, but perhaps what you're saying is no PFA without proper MHPSS programming.
Yeah. Definitely.
Well,
yeah.
Well, so this takes us very nicely to the next question, actually. So working out really well in terms of sequencing, because one of the key principles that PFA is premised upon, both in terms of how it's constituted, as well as what it says in the content that's delivered, is that of do no harm. And I'd like to ask, through your experience with the retrospective, but also your other work, does PFA in practice stay true to this principle? Can PFA be broken, used in ways that is perhaps stigmatizing, perhaps disempowering? And that's at the level of just, one-to-one delivery of PFA or PFA. But is there also a question around how PFA is used, the way that PFA has been used perhaps in terms of a larger MHPSS response? Has it displaced other funding for other activities? Has it drawn people into just this area of activity?
I think that those questions are actually really interesting for our participants. Perhaps they could share their experiences in the chat box. Yeah, in general, I would say that what's very important is fidelity to the model. We wrote this very simply, and we did that for a reason. Because it's very hard to write or to assume that we know the priorities and can articulate what is best for people in every culture, in every context. So there is a basis here that's about human rights, and again, those principles are at the core of really what needs to be upheld. So I think PFA perhaps can do harm inadvertently if people don't truly understand the principles behind it and the basic do's and don'ts. And there are misconceptions even after an orientation. Some people still don't understand why you don't give advice, or why it isn't a good idea to judge people for their actions, for example. And some of this is a cultural and contextual negotiation that needs to happen with PFA. I'll just point out here, just a quote, to kind of underscore that just like with medical first aid, PFA is not enough to cover all MHPSS needs in emergencies. So there needs to be other things that happen as well. And we did ask people what they thought the biggest risks were. And the top risk is really that people trained in PFA believe that they have clinical or counseling skills. They receive this training and then they think that they can do more than they're actually capable of. So I think that's where some of the harm has come in. And people did say that they have seen that in the field. And again, it's another reason why we don't do an accreditation of any kind for PFA. So again, there needs to be some caution about how we're presenting it to others, and how we're articulating it for ourselves. And then maybe I'll just move on to the next slide. When we ask the question, what are the potential dangers that you see of PFA? I had a couple of people who had never heard that there was any discussion or debate on dangers. And they said, well, I thought it was the do no harm alternative. I didn't know there were any dangers at all. I thought it was for that reason that it was developed. So somebody said, what's the damage really if anybody just takes it and runs with it without lots of training and supervision? What damage can it do to listen to people and link them with help, etc.? So I thought that was a very interesting comment. That comment came from somebody who has actually done large-scale capacity building. And their experience of it was, it's a pretty soft kind of a guidance to be giving. However, the danger you see on the other side of the slide, other participants said, well, we've gained ground in that it's legitimized a lot of what we do in MHPSS, but we lost ground in understanding the breadth of experience that's needed for MHPSS interventions. And then also, where do people fit in terms of their ability to offer help along the spectrum of MHPSS interventions that we offer? And I think there's also, Ananda, this might actually be your quote, in the spectrum of offering a cup of tea to psychological intervention, do people really know what it is? It can become everything and nothing. Do you have some recollection of that?
Perhaps a vague one. I mean, I think this is something that I've heard very often from colleagues in the field that whilst not wanting to undermine or underplay the real meaningful nature of what people can offer one another in an acute setting using the principles of PFA. There can sometimes be a loss of understanding that people do have complex and serious problems for which you need to have appropriate responses, and that kind of perspective is something that is also hard when you're quote unquote promoting and selling this wonderful thing that you're trying to get people to take up on a large scale in a more public way.
Yeah.
And there can be a danger of not necessarily always of the PFA trainers, but of programs overselling what PFA has to offer.
I was able to see one chat that came through, and it said, what types of MHPSS programming goes best with PFA? I'm sorry, I'm not able to see the rest of the chat, but I think that's an interesting question.
Particularly related to staff care is the rest of it.
Particularly related to staff care, right. So I think what often happens in a PFA orientation, and I have warned organizations about this if I was invited to give a PFA orientation to, say, their emergency response team, I tell them in the beginning that at the end of it, your staff are going to ask you what is available for them and their own care. It happened every single time I gave an organizational orientation. So it begins to raise awareness about how we're feeling when we're in the field. What we need to think about, the distress of our colleagues who are working alongside of us. So I think for MHPSS program related to staff care, that PFA may be that entry point where you need to start developing staff care systems and policies and training people a little bit further on what that means. So more of the prevention aspects of how do we keep people healthy and well as they do this difficult work. Oh, you're muted, Ananda. Sorry.
I'm sorry, Leslie. I was just saying that I note that we do have some time constraints, and so I'm wondering whether it might make sense to shift along to the next question, which I think perhaps relates a bit to the previous comment you were making about, the simplicity and the core messages and values that the material contains, and the fact that
I'm moving ahead. I'm sorry. I was finding.
I'm sorry. Just in terms of what really works in terms of getting those messages across, because as we know, PFA is being provided to a wide range of individuals from a wide range of personal and social and cultural backgrounds in a variety of settings. And we're saying, come into this, we're going to do an orientation session for a half a day, 1 day, 2 days, but you're going to have to, in a sense, square your usual way of dealing with people in crisis or dealing with problems with these new values and ideas that are contained in this material. What works in terms of getting the material across to people, and how do we help people take that out beyond the training, beyond the orientation?
Yeah.
There's a question about supervision for people who've been trained beyond.
Yeah, and I'll refer you to the retrospective itself, which we did. We asked a lot of questions of people about orientations and training of facilitators to give orientations. So I'll refer people to those. But I think what's really, really important, and what participants noted, respondents noted, was that you need to have materials in the local language, adapted and contextualized, hopefully by a group of people from that culture and context who can look together at those materials. And it's slide 36, Ananda, if you could get to that one. Yeah. And it needs sufficient time. A day is better, but even 2 hours we found in the Haiti earthquake response when we were piloting was helpful for people. So don't not do it just because you only have 2 hours. But no matter how much time you have, it has to be practice-based. You need to give people the opportunity to practice skills and to really try out things. And I would hope also that these are not really new values, that these resonate with what people already know how to do. There are also respondents and people that I interviewed who said, don't use the term psychological first aid. You don't even have to call it that necessarily. There's a lot of misconceptions around the term. And this particular person has never used that term, but still trains in the exact principles. So I think in some ways you avoid some of the pitfalls if you also don't necessarily have to call it something with the word psychological in the name. And I would say in terms of supervision, it's not always feasible to give supervision. And for orientation, I think it depends on your relationship to the people that you're orienting. If this is a psychosocial support team that you're going to be working with over time, then and it's couched within a larger training on different kind of skill sets and programs and tools, then definitely supervision is a part of that and should be part of that when they're in a position where they would be offering PFA if there's a crisis event. I think for training of trainers, however, supervision opportunities for coach trainings are very important. And we have found this ourselves, that it depends a bit on the skill set of the people who are attending the TOT. Some will have a lot of training expertise or MHPSS expertise, but not always. And it's not always easy to find people with that range of skills. So I would say, particularly if your organization is doing a training of trainers and offering this more widely, if you can provide that supervision and support and build a community of practice, you have a much better chance of people really holding fidelity to the model as they roll it out.
Thank you, Leslie. I think, certainly from my personal experience, the points you raised really are extremely important, and the practice dimension and the coaching dimension in relation to the TOT again, I think are invaluable. Thank you. The PFA, as you said, we tried to write it in a way that was simple, was stripped of as much kind of cultural framing as possible. In terms of the retrospective and conversations you've had with people around the process of adaptation and both to culture and to context, what have you found? How true is it that it is, in some ways, universally adaptable? And also the question, I guess, arises, how much can you adapt PFA before it is no longer PFA, before it loses some intrinsic part of it? And what's the experience been to date?
That's great, Ananda. I would say that here is where the feedback we received was very positive, that it's not necessarily simple to do a translation or an adaptation, but in fact the material does lend itself to that. And one of the important things that we heard was, if you're doing anything to update the materials, don't change the basic concepts, because they work and because they seem to have worked over time and in different contexts. So I think it is very adaptable, but it's really in the way that you approach that adaptation. And I was very impressed with how you did that in Sri Lanka, because you really did bring a community together, a Tamil-speaking community and Sinhalese-speaking community, and they worked in depth, word for word, together on looking at the concepts and seeing what adaptation would make sense. And I suppose it works well because it taps somehow into common humanity, and again, these shared values. The translations do get a check by WHO to ensure that there's fidelity for each of the ones that are posted on their website. But I think it also is important for people who are adapting and translating to look at those core principles, the core do's and don'ts, and make sure you stick with those. I'm wondering what you think also, Ananda, in answer to that question.
Well, I think I've been struck to some extent by how limited some of the adaptation has been in terms of the fundamentals. A lot of it is about language, is about kind of scenarios that you'd use. And there was a question also from Kavita, I think, asking about the adaptation of PFA related in response to the Rohingya crisis. And I had the opportunity to work with colleagues in Bangladesh who were looking at using PFA and adapting it. And a lot of the adaptation really was about the kinds of scenarios that people found themselves responding to, the circumstances that people were responding to, and are also being aware of the available resources. I think that's a key element, because PFA as it is a set of skills and approaches that you use in navigating a difficult circumstance that often requires practical action. And I think the adaptation really has to take into account what the norms and resources that are available are in terms of people being able to respond appropriately.
I think your latter comment about resources is probably a very critical one. For example, what supports are available, and in what ways do you need to be creative in places where there are not formal supports to be using the natural networks within communities.
So what I would like to ask you, Leslie, because we really, unfortunately, are somewhat out of time, is where do we go from here? You've done the retrospective. You have a sense of what the field has done with it and some of the issues that have come up. What's the next 5 years looking like? And there's a question also from Monica who says, do you feel that the reliance on PFA is perhaps keeping us from developing further approaches, perhaps much like the way in which, child-friendly spaces, took up a lot of space and resources and initiative, and only now are we trying to see beyond that?
Well, I would hope in some ways that it might inspire us to develop other types of tools and training that are widely accessible. A lot of what we have is developed more for professionals, but I think maybe something that the development of this guidance has highlighted is that we need to put more accessible resources into the hands of community members, families, caregivers, children and youth themselves. There's a child-to-child PFA adaptation that Save the Children is doing. So I would hope it would inspire rather than limit us. PFA it's one resource. It's one approach. It's one set of skills. So it wasn't meant to be bigger than that. But the experience of it is that there is a real thirst for these kinds of accessible resources. So I think that's probably the biggest lesson we could take away as we move forward and develop other resources. And you have the slide up on, or we don't have the slide up, I think, priorities, areas. Let me just go back there. What participants, respondents said that we need is mainstreaming across sectors, strengthening the evidence base, and ensuring quality in training. So those would be some of our next steps. And also in terms of materials, for example, there were a lot of people who weren't aware that there were, for example, an online training, but we need to make more interactive technologies available for PFA. They do exist for some of the other models of PFA, and more things that can help people contextualize. So the core guidance, it seems like it's held up, but more tools on localization and contextualization would be helpful. I also want to just get to this particular slide, because these are our summary recommendations, and you can read these in more depth in the guidance itself. Sorry for the jumping around on the slides. But basically, what came out of the whole retrospective is that we need an updated overview of the field itself that's clarifying where PFA fits and is also documenting this spectrum of tools and approaches and resources that have been developed over the past 5 years since PFA was launched. So I think that would be really helpful if people had a better understanding of the array of MHPSS approaches to draw upon. And number 2 was keeping attention to it as a foundational component of various approaches or training and skill sets that people need. It is a sort of foundational skill, communication skills, understanding how to refer, and understanding how to approach people according to certain ethical principles. Developing the innovative technologies. The 4th is promoting fidelity to the model with support to capacity building initiatives, dialogue, communities of practice. We do have our PFA adaptation group on MHPSS.net. And then the last recommendation was developing common approaches and tools for M&E and researching the relevant aspects of PFA. So those are the 5 recommendations that you can read about in more depth. But I also wanted to be sure to kind of end with this slide. As I've worked with it and spoken with various people around the world in terms of how they use it or how they conceive it, I think I come back to one particular core. And this is a quote that you see from an aid worker in the Palestinian territories who said, "You are dealing with human souls. If you don't know what you're doing, don't come." And I was very struck by, the person said this to me when we first met, and I was very struck by it. I never forgot it. And I wonder if when we are dealing with people in the moments of extreme vulnerability, which is after crisis events, after war and natural disasters and other events, these are moments of real chaos and transformation in people's lives. And it requires an extra level of awareness and consciousness about how we relate to them, how we approach them, and how we support them. And what I'm hoping is that PFA, in its very simple way, can help various people to have more awareness and more consciousness as they do this work. And hopefully so that we can do it better and with more kindness. I think you're muted, Ananda.
Thank you very much, Leslie.
Yeah.
On that note, I think I just remains for me to thank you for the time and for your reflections. It's been really we've covered a lot of ground. There were a lot of different a wide range of very profound and important questions, which we had to deal with within an hour, and I think it's been really valuable and insightful. Thank you. And to all of you who joined us today, thanks very much for the questions you sent in and for your participation in the session. We will be posting our this webinar as a recording on our YouTube channel so that we are able to share it with colleagues who aren't able to be here. And I hope that we're able to, find some way of taking this conversation forward with you, Leslie, and with other colleagues in the field around what do we do with PFA going forward. Those recommendations seem, comprehensive, daunting, but also quite hopeful. So thank you all, and please do remember to take our exit survey before you leave the room today, so that we know what you've thought of the session today and how we can build on it and follow up in the future. So thanks very much, everyone, and
Thank you.
look forward to seeing you next time.